Hello and namaste. How are you all? Staying safe and staying calm, I hope. This is Dr. Srinidhi Chidambaram with the COVID Care series presented by Apollo Hospitals. Living through the COVID-19 pandemic is not at all easy, as we have all seen. Working from home, worrying about family members, taking care of the home and kitchen during lockdown situations, coping with the children at home who are stuck for months on end. Very, very tough and exhausting. But for people with non communicable diseases like heart disease or neurological disease, diabetes, cancers, hypertension, liver or kidney disease, the worry is even more. Are they more vulnerable? If they get COVID-19, will it be more severe? Can they get vaccinated? What will happen if they need to go to hospital for an emergency for one of their conditions? Can they get the vaccine or not? Is it safe to go get the vaccine? So many questions, so many concerns. To clarify all such concerns, we bring you special episodes that focus on each of the non-communicable diseases. And today, we are addressing managing neurological conditions and disorders during the COVID-19 pandemic. The expert who will be speaking to us today is Dr. Suryanarayan Sharma, consultant neurologist practicing at the Apollo Hospitals, Bannerghatta Road, Bangalore. And he has an experience of over 17 years in this specialty. Dr. Sharma completed his MBBS from the JSS University, Mysore in 2004. And in 2007, he completed his MD General Medicine from the JJMMC Davangere RGUHS Hospital, Bangalore, and completed his DM in Neurology from the same institution. He is a member of the Karnataka Medical Council, Indian Medical Association, IIN, APIM, and the American Academy of Neurology. Hello, Dr. Suryanarayan Sharma, and welcome to this FB Live. Let us begin with an overview of coping with the various neurological conditions and diseases at the time of the COVID pandemic. I will leave it to you to give us now the most important points that people with neurological conditions should know and should address during this very, very challenging time. And I'm sure you will also tell us about the precautions that they should take, what will be the severity if they get COVID, or also another angle on how they can access follow-up or surgery or even rehabilitation and physiotherapy. Over to you, Dr. Sharma, after which we will take some questions from our viewers.
Namaste, welcome. On behalf of the Department of Neurosciences, Apollo Hospital, Bannerghatta Road, I welcome you all to this COVID Care series, wherein as a Apollo family, we are going to enlighten and create awareness about the neurological conditions in COVID. Thank you, Dr. Srinidhi, for those kind words on us. So definitely we'll make this Facebook session more interactive. Next 10 to 15 minutes, I'll be briefing about some of the common neurological conditions, what we come across in the last 1 year, and also what are the precautions to be taken for vaccination. And maybe after that, we will take questions one by one so that our viewers will be interested to interact and discuss. Friends, actually the whole country is passing through the real testing time of COVID-19. It is a tsunami of the second wave, which is affecting most of the cities in the country, and in Bangalore, especially in Karnataka. Unfortunately, we are seeing a lot of spikes in the COVID cases, and here we are in lockdown. Actually, the creating awareness is one way to alleviate fear. Actually, every one of us will have some fear about the disease. Even the healthcare workers, when the disease came to India in March 2020, even the medical fraternity also was having some of the issues, understanding of the disease, understanding of the systems, organ systems it is likely to affect, and it was a learning curve. But now, definitely, we are far better. We are learned. We know how the disease goes, we know the treatment protocol, and definitely we are going to save more lives from COVID-19 and neurological conditions. So to highlight some of the important diseases, first thing I would like to emphasize is the stroke. Stroke is one of the commonest medical emergency, and if you see globally, it is the second commonest cause of mortality worldwide. Around 18 million people are suffering from stroke every year. So why COVID and stroke are interlinked? Because COVID, if you know the pathophysiology of how the virus affects the body, it is likely to cause a lot of thrombotic state. Thrombotic state means there can be clot formation inside the blood vessel. So it is said that 3 to 7 times there is an increased risk of stroke in COVID patients compared to non-COVID patients. So during first wave, we saw even from starting from April till the whole year, we saw multiple cases of acute stroke in COVID. If they had risk factors like diabetes, hypertension, heart problem, the risk was much higher. But friends, let me tell you, even those patients who didn't have any risk factor, we have seen a lot of stroke patients. And the treatment of stroke remains more or less the same as non-COVID patients. But however, because of triaging and doing COVID RT-PCR and maintaining the isolation, personal protective mechanisms, everything, we in most of the Apollo centers ensure that the COVID care, the stroke care doesn't get affected during COVID times. I'm just happy to say that we have actually thrombolized more than 12 cases during COVID, and even we have done mechanical angioplasty, brain angioplasty in COVID patients, and even we have done operation as a life-saving measure in COVID patients. That is during the first wave, but we knew the mechanism better. So we started giving blood thinners, anticoagulation to most of the patients who got admitted. So definitely, in last 2 to 3 months, I am seeing a downward trend, or it has plateaued. The acute incidence of acute stroke in COVID is definitely lesser compared to the first wave. That is because of the better understanding of the subject and early use of blood thinners and anticoagulation. Generally, we give it for 3 months so that the patients do not have a stroke or a heart attack. And even the risk of pulmonary embolism and even the deep vein thrombosis of the legs, even that risk is lesser in COVID patients with the use of medicine. That's where I say the knowledge and awareness is definitely better in understanding the mechanism of stroke. So we will take the next question, that is about the nerve involvement in patients with COVID. I'm sure once the patient goes to ventilator in a COVID situation, definitely they are going to stay on ventilator for at least 7 to 10 days. In such situation, there are two things which are possible. One, every nerve has a myelin sheath. It is like you imagine a nerve is an electric wire. So every electric wire has an insulation tape around it. That insulation tape is made up of fat. So there are two conditions which are possible. One, we call it as Guillain-Barré syndrome, GB syndrome, wherein every nerve, the myelin sheath, the insulation tape of the nerve can be damaged because of some of the proteins which are triggered by this viral infection. So that is a treatable condition. It's a rare condition, but actually we have seen quite a lot. In first wave to second wave, I can say I personally have seen at least more than 15 patients. In our Apollo unit, Banerghatta Road, we have seen close to 30. So that 30 is actually what we see over 1 year, but we are seeing only during one season actually. So that is one thing which we have seen. It's a treatable condition, but early diagnosis and early treatment is the key here. And second thing, we have seen a lot of neuropathies. Neuropathy means basically, imagine your body is fighting for life. So here, the requirements of the vital organ takes precedence over some of the not so vital organs like peripheral nerve. Suppose if there is a nerve which is there, so nerve needs nutrition. So suppose that nerve is deprived of nutrition because body is channelizing all its resources to survive, to save itself. So in this process, a lot of nerves get weaker. So this we call it as critical illness neuropathy, or even during post-COVID time, we call it as post-COVID neuropathy. Many of these patients will have nerve involvement, but luckily and fortunately, many of these conditions are treatable. So we need to keep neuropathy as one of the important condition. So generally, if any patient, even when we are doing COVID rounds, so we see if the patient has even minor neurological symptom, we give nerve protecting medications and we ask them to take good diet, good physiotherapy, so that these are all reversible conditions, but that causes a lot of discomfort to the patient. So we need to keep that in mind. Now, coming to the third important condition, that is the infections. So one of the common, I can say a pandemic epidemic in a pandemic, that is a fungal infection of the brain. So this we call it as black fungus or mucormycosis. Unfortunately, it was not so common in first wave, but in second wave, it is claiming a lot of lives. So I request, my patients and the viewers to have some kind of a suspicion, because here, unlike other infections which come along with COVID, if there is a stroke, it comes along with COVID. Here, it comes usually after 2 to 3 weeks after the COVID infection. You see a patient gets admitted, gets treated, and goes home. He's happy that patient is fine. He's get rid of the COVID infection. But what happens is after 2 to 3 weeks, they may present with some kind of a pain or a numbness over the face, or sometimes if they are elderly, they may have loss of dentures. And if you don't recognize that early, sometimes they can have eye involvement, that we call it as the proptosis, eye swelling, and the movements get frozen. They become blind. And once this fungus invades the brain, we call it as angio-invasive mucormycosis. They present with stroke, they present with encephalopathy, and most of them don't survive. So this has a mortality of more than 50%. I'm not telling this just to scare anybody, but what I'm telling is if we pick up in early stage, like if they have only swelling of the cheek here or even in the sinuses, then definitely doing operation like debridement and giving antifungal will cure this problem. So what are the risk factors for this condition? Number one, COVID itself can have modulation, that is immune modulation effect on the immune system. It will change the immune system. Second, many of these elderly patients who get affected, they are diabetics. So obviously the sugar levels will be much higher. So they have a higher risk of getting this opportunistic infection. Third thing, those patients who are on steroids, these patients, COVID, I think you all know that steroid is mainstay of treatment. It is a lifesaver in COVID, but steroid is like a double-edged weapon. So whenever we are treating, we should be cautious about, the use of steroids. Number one, sometimes, if we don't monitor sugar properly, the sugar risk or the risk of infection like mucormycosis is much higher. The third thing what I would like to emphasize is if patient is on high flow oxygen for a longer time, suppose if patient required oxygen for 7 days or 10 days, then that also we need to keep in mind, because the humidified oxygen may also be a source of a contaminant fungi. So these three things, I think, friends, keep in mind. One, if the patient has any symptom after 1 or 2 weeks, after COVID, like headache, facial swelling, facial numbness, please visit your doctor. Control your sugars. Control, if still due to medical reason, if doctor is giving you steroids, maybe checking the steroid on a daily basis at home and consulting your doctor would be ideal. So this is, unfortunately, epidemic nowadays. I would say mucormycosis, whatever we have seen in last 1 month is what we used to see in the whole year. So that is the number of cases what we are piling up. Last one, I would like to emphasize.
If I can just interrupt here, there has also been some talk that mucormycosis, one has to be also careful of very early taking steroids early on or without proper medical advice, because there is a general, sometimes people also like self-medicate. So could
Definitely.
you tell something about it? And also a lot of people are given the steroid sprays also. Does that pose a risk for mucormycosis?
Yeah, that's a good question. Basically, steroids generally we don't give in mild to moderate infections. We recommend steroids in those patients whose saturation is down, who have respiratory distress, who are admitted, whose inflammatory markers, the markers of infection are very high. We don't give generally steroid in either COVID care center or home isolation. So please understand these two, wherein most of the patients belong to this category. If you see 100 patients of COVID, 60 to 70% may not require steroids. So they are all mild cases. So they get better with medicines and with some monitoring. Only in those patients who need steroids, as you said, definitely those who are on spray, they need to do gargle, the saltwater gargle or a betadine gargle. They need to clean their nose and sinuses regularly so that the risk is lesser. So, without supervision, steroids are not advised in COVID. Yes.
Sure.
Yeah,
Thank you.
and coming to some of the important things like patients with seizures, epilepsy. So if they have COVID, because of high fever, they may get either one attack of fever, one attack of fit, or because of lack of sleep or lack of oxygen, they may get a fit. So don't panic. In that condition, what you need to do is continue your regular dose of anti-epileptic medicine, whatever. And if you get admitted with COVID, please inform whatever medicine you are taking to the concerned specialist. That is one. Third thing, a lot of our migraine patients, so they present with worsening of headache or recurrence of headache, and this is a condition wherein we always tell the patient relative. Suppose if there is any change in the pattern of headache, if there is any change in the type of headache, if you are a migraineur for last 10 years, you know your headache better when it gets triggered, what are the seasonal variations and all that. But in COVID patients, definitely any new onset headache or worse headache should be kept in mind. And another thing I would like to say is risk of Bell's palsy. Bell's palsy is one half of the face. Usually, if you exactly split the face in the midline, the facial nerve, we call it as cranial nerve number 7. So it supplies the whole face. So the upper part, eyelids, even the lower part, and the next to the cheek. So many a times patients present with paralysis of one side of the face. So this is also one of the common thing with COVID infection. So these are some of the common neurological conditions what we come across in COVID patients. And I think we will take some questions, and regarding vaccine, definitely I will enlighten maybe at the end.
One question is, are there any neurological conditions that will by themselves increase the risk for COVID-19?
See, neurodegenerative conditions like Parkinson disease, Alzheimer's disease, and those conditions, usually patients' immunity will be down either because of poor nutrition, and risk of infection will be much higher. Most of the degenerative neurological condition, patients are usually above 65 years, which are by themselves, they are vulnerable for any infection risk. And definitely Parkinson disease patients, because they're just, the breathing pattern, unless they do regular exercise and yoga, usually they have some sort of a, breathing issue. Sometimes patients with myasthenia. So these are all conditions, or patients who had stroke and recovering with, some sort of a disability. So they are all actually, we call them as high risk or vulnerable patients. So we used to actually, because of the increased risk of COVID in them, we used to practice reverse quarantine for them. So we used to tell them, especially in the first wave, if you have anybody who is working outside, please, have a separate room at your house. You stay separately. Do not, do not regularly interact or socialize with your own family member. We used to tell that. Yes, definitely, there is an increased risk of COVID in neurological patients. Yeah.
Speaking about dementias, now if there is a patient with dementia, how do you, it is a challenge to get them to observe all the precautions and hygiene in order to avoid COVID-19 infection. So are there any tips for caregivers and people who are caring with people with senile dementias and Alzheimer's on how they can make sure that these patients are not posing a risk to themselves for COVID?
Yeah, I'll take it up this question in two separate, subheadings. One is a dementia patient who is like mild to moderate degree, wherein he can do all his activities himself, number one, and most of his activities he can do by himself. Only thing is he needs support or assistance while he goes out. Okay, so in these type of patients, definitely, staying in, practicing strict isolation measures, taking medications on time, having a good diet and hygiene is most important. So I think this will solve their most of the problem. So luckily we have a good lot of patients who belong to this category, so that our burden on healthcare givers is lesser. Coming to the later part of your question, patients with severe dementia who need caregivers support. There are two problems with caregivers. Number one, caregivers can themselves be a carrier of COVID-19, and they themselves can be a bigger risk for this type of patient. So we generally tell the patient relatives that unless patient is too sick or moribund, generally we encourage only family members to take care of these patients. But especially in severe dementia or severe cases wherein their personal hygiene itself takes a task, then yes, definitely we suggest the caregivers to practice strict hand hygiene and strict hygiene precautions, and do aggressive physiotherapy, because the breathing pattern usually they will have a lot of aspiration, they will have a lot of hypostatic pneumonia, so wherein that itself can trigger the risk of COVID. And keep the room well ventilated, and especially if there are any family members who have a risk of COVID, or if there is a exposure or primary contact or secondary contact, please avoid. Sometimes actually I tell the family members that don't visit your parents. Sometimes they stay in the same apartment in a different tower. So suppose if somebody has a risk of COVID, we just tell them, okay, fine, you just monitor them either by video call or something, just supply their essentials, and don't enter there. Because most of the dementia patients who had COVID and who were admitted with me, absolutely there is no history of travel. Last 6 months, 8 months, they have not even come out of their house actually. So you can interpret this in this way, that either the other family members who have gone out, they have given the infection to them, or the caregiver who comes to the house regularly to clean or help the patient, so they give the infection. So yes, your question is very valid. Definitely there is a increased risk. So I urge all the audience, especially if you have any elderly at home who are frail, who need support regularly, please, please do not be overconfident. Please think about them. Please help them whatever you can, but never socialize with them. And especially don't allow your kids to play all the time with them, because in first wave, kids were they were asymptomatic carriers of the infection. So they go out, they play, they come back home and give the infection. They may be, even if you do COVID, they'll be negative, but the whole house, the whole family gets infected with COVID. So my message is that.
Should a patient on medication for any neurological disease, do they need to stop their medication if they get COVID?
Most of the medicine you don't have to stop, number one. I can broadly classify this into a patient on stroke medication. Stroke medication, unless the doctor tells you, don't have to stop any of the medicine. Suppose patients on fits medicine, you have to continue fits medicine. There are instances wherein the patient with COVID have stopped fits medicine and they have landed up in seizure and they got admitted here. So it is absolutely not required to stop any of the neurological medication. Parkinson disease medications, yes, you have to continue. Dementia medication, there is a catch here. Some of the medicine we don't give during COVID time, because that depends on the consciousness of the patient, alertness of the patient, what is the mobility, what he is having, and other medications what he is taking, because they may become drowsy a little if you give these medicines. So in such situation, definitely they need monitoring of a neurologist. Yeah. So apart from dementia or one or two conditions, in most of the conditions, we continue all the medication.
When there is moderate vision loss from optic neuritis and a person is on steroid treatment, does that condition and the treatment them at higher risk for COVID-19?
Yeah, steroids, those patients are on a good dose of steroid. Good dose of steroid means it has to be at least 1 milligram per kg per day. Suppose you are 60 kg, at least 60 milligram per kg, 60 milligram per day. 60 milligram is a big dose. But usually if patient is on optic neuritis or any other condition, we hit them hard with good dose of steroid for 3 to 5 days. After that, we taper the steroid. Suppose you are, you are on 0.3 mg per kg or lesser than that, or if you have already stopped steroid, then the risk is like any of us. But if you are in a big dose of steroid, yes, there is a slightly increased risk of COVID. Yes.
When there is a neurological condition, most people are prescribed physiotherapy or going for rehab. So when such, either the physiotherapist may be coming home or they will be needing to go to the hospital. So how does this work during the pandemic time when there is COVID infections in the hospitals? Is it safe for people to go? But what happens if this is discontinued, or I'm sure there must be facilities for video consultations? What is your advice, doctor?
Yeah, during first wave of COVID pandemic, they stopped as a law. Many societies, many governments have stopped home care physiotherapy, like physical contact between the caregiver and the patient. So actually, unfortunately, many of my patients, they had spasticity and contracture because there was no one to help them. Many apartments never used to allow physiotherapists inside, and even the healthcare workers, the physiotherapists themselves were very scared to go to give bedside care to the patient. Suppose there are two types of physiotherapy. One is active and passive. Active physiotherapy means you can, it's like a Zoom meeting. You just guide them how to do. That is possible only if the patient is having a good power, good reasonable strength, and he is able to ambulate himself. So in such patients, yes, guiding them telephonically or by video consultation, or maybe once in a week you call them for a checkup, just give some task, so you keep that going. So that's easier, and that is largely for patients who are ambulatory. But here the main problem comes wherein we have a good lot of patients who are bedridden and they need bedside. So there is no way that a caregiver cannot come or can come only virtually. So here what we generally recommend is to avoid lesser exposure. We ask them to go either on alternate days or weekly twice, and they actually, if there is any family member who can volunteer to do physiotherapy for them, we teach them how to do, and therein actually we can help them. So the risk of infection is lesser. Third thing, earlier we used to do COVID RT-PCR on all the healthcare workers, especially during first wave, regularly, at least once in 2 weeks or once in a month. And we used to, all these rehabilitation centers, we used to ask them to do RT-PCR testing for the healthcare workers. But definitely after taking, I think most of the healthcare workers are vaccinated with both the doses now. Most of the physiotherapists are vaccinated, at least my center, everybody is vaccinated. So that risk is lesser. But as you said rightly, we need to be very cautious. We need to choose patients who are for physiotherapy, avoid direct exposure to the patient as much as possible. At the same time, we cannot neglect the physiotherapy aspect of it, because that's very, very important.
Yes, that's why I asked the question. Doctor, there are now questions from our live audience, so I'm going to read them out and I request you to please answer. The first one is, after recovery from COVID in September 2020, my right side of the body shakes a lot, and the patient, the patient is 81 years old, and there is a lot of shaking in the right side of the body. So,
if I look at this question, there may be a past history or a antecedent Parkinson disease like illness. Usually they'll have, if you keep the hands like this, there may be mild shaking like this. So that may be unnoticed, or somebody would have said that, okay, it may be age related, and they would have ignored it. And after COVID, definitely it would have become manifest. So if it's only right-sided shaking, I would say that it could be early Parkinson disease. It's always better to get a neurologist evaluation, number one. Number two, there may be a small stroke in the brain which controls this tremors. This controls the movements of the hand. So that it can be a very small stroke. It may not cause loss of power. It is a non-paralytic stroke. It may not be loss of power, but it can be related to tremor. So I think, as you said, either a small stroke or a Parkinson disease would be the reason in this. It's better to get evaluated.
I have hypertension and I'm 62 years with gallbladder calculus. How can I get vaccinated?
Yes, definitely. Now I think you have come to the most important part of the topic, that is vaccines in neurological conditions with in the patients. Generally, we encourage everybody to get vaccinated. Earlier days, when it was started, the campaign started, we all took, healthcare workers took, number one, basically to protect ourselves. Number two, to encourage and create awareness about the public regarding the safety and efficacy of the vaccine. Now, with the second wave coming as a tsunami, there are, large number of data coming from ICMR that, both Covishield and Covaxin are very good in giving both efficacy, and safety profile is also good. Though there were reports of having, clots, the thrombosis of blood vessels following Covishield. Yes, there are cases we also have seen, but they can be, statistically, they are not significant. Statistically, if you apply, the science, so it is not so significant. So we can safely take the vaccine. Number three, in what cases we avoid vaccination? Suppose if there is a severe allergy to any of the molecules before, we generally tell them, if there is any past history of allergy to any vaccine or vaccine component, we ask them not to take. Second thing, in special type of stroke, either a cardioembolic stroke or patients with heart attack, or those who are on stent, they may be on anticoagulation with acetrom or any of these molecules. In only them, we do the blood test, that is the PT-INR. We just see that if there is no higher risk of bleeding, because if the moment they put an injection here on patient on a good dose of acetrom, the blood is in a fluid state and it may cause a hematoma. So that is a major risk, and that's the only risk. But in them, what I generally do is we do the blood test, and if we feel the patient is safe enough, we stop only one dose before. Suppose your vaccination is scheduled for tomorrow, we stop for today, and you take the vaccine tomorrow, apply a good pressure for 5 minutes over the injection site, and by evening you can take all the medications back. So all the medications, like let it be stroke related, let it be fits related, Parkinson disease related, you don't have to stop any of the medicine for vaccination.
The next question is, we are noticing neurological issues amongst family members like disoriented behavior, forgetfulness, etc. I'm not sure, doctor, what this question is, but I think it's something to do with post-COVID.
Yeah. The post-COVID, even during hospitalization, we call it as COVID encephalopathy, wherein patients will go into a delirious phase. So they will not be able to, it's like a semi-conscious kind of a state, wherein they will talk to you, but they will not recognize who you are, number one. And number two, their behavior may be a little erratic. Sometimes they become a little violent. So we can actually treat them with medications. We have antipsychotic medications. Sometimes we ourselves give or take psychiatrist help and give. It is a transient phenomena. Usually 1 or 2 weeks it will be there. And in some cases, what I have seen is, suppose an 80-year-old patient, he may have dementia, but it may be just passed off as a normal age-related problem. So in that patient, if he gets COVID, then yes, definitely he may take longer time to recover, and sometimes his dementia can get actually worse. And many a time we take the history again, we go back to the relatives and ask, how was your patient before? So then they will tell, yes, My patient, he was missing, he was not very keen, he was missing mobile numbers, he was not recognizing some of the distant relatives. So those histories will come later. So we have to, we have to keep this in mind.
So they need to perhaps see a neurologist or a psychiatrist and address this issue.
Most of them, if they get admitted, by the time we discharge, these problems either would have been sorted out or we'd have counseled the family members that whether it's going to recover or it's going to stay with him, or sometimes it may recover for 3 weeks to 6 weeks. So most of these patients, what you're mentioning, they are all admitted patients. So they are not home isolation or anything. So either they would have seen a COVID specialist physician or a neurologist if it's a bigger hospital. So I think that would have solved their problem.
My uncle got half of his body paralyzed and went into coma, was on a ventilator and died after 4 days. What could be the reason? He was a COVID patient and on 10th day it happened in the hospital where he was admitted and he was on oxygen.
See, COVID with stroke, as I highlighted in the past, so there is an increased risk of blood vessel clotting with the COVID infection. We give heparin, which is a blood thinner injection. So in most of the patients who are on ICU and oxygen, but unfortunately, any of these measures, either giving heparin or giving, socks to prevent clotting in the legs, they are all 70 to 80% effective. Rest 20 to 30%, there is always a risk of stroke. So we always, keep a watch daily. Sometimes what would have happened is possibly there may be a heartbeat variation. Patient was on oxygen, patient is in ICU, he is sick. So there may be a heartbeat variation, we call it as atrial fibrillation. So that would have thrown a big clot from the heart to the brain. So that would have blocked one of the major blood vessels of the brain, and that's how this patient would have, unfortunately succumbed.
A person had myelitis problem, admitted for 15 days. After admitting, doctor gave 48 hours time. Due to this, potassium deficiency took place. There's also uric acid increase. On having a person having this type of problem, can they take the COVID vaccine?
That depends on when the patient had this problem, actually. Suppose any of the acute neurological condition, suppose a patient has a stroke today, I would like to avoid giving COVID vaccine for next 4 weeks. So generally, if there is any acute history of a neurological condition, in your case, you are referring to a myelitis, transverse myelitis, what I presume. So I generally wait for at least 4 weeks for vaccination. Suppose if it is beyond 4 weeks and patient is not having any progressive symptom, it may be a static symptom. He might have had a paralysis of one side, or in transverse myelitis, what we say, paralysis of both the legs, and it may be stable. If there is a stable disease, you can still vaccinate. But if there is progressive disease, I think you have to wait.
Sure. There are also other questions about memory loss and mood swing post-COVID, which I think you have already discussed. And there's another one about the woman with Parkinson's. Can they take all the COVID medications?
Yeah, as I highlighted before, if patient is Parkinson's with COVID, please take all the medication. Please do not stop any of the medication. Suppose we stop some of the medication based upon the patient's alertness, condition, and consciousness, but that is left to the discretion of the doctor. But if patient is stable, mild COVID, there is no need to stop any of the medications.
I think the question is, can they take the COVID medication, by which I assume not just the paracetamol. I think, can they take all the, if they
Yeah. COVID means it can be a mild COVID, moderate or severe COVID. It involves all the medications. Either it can be azithromycin, it can be doxycycline, it can be ivermectin, it can be even remdesivir. You can take anything, not a problem. Steroids, yes, you can.
Sure. I think that's about all we have. But I would like to thank you, Dr. Sharma, for this very,
Sure.
and very informative discussion. And if there are any more queries, viewers, please reach out either as messages on our Facebook inbox or place comments in the Facebook page. And I'd like to thank you once again, Doctor.
Thank you. I just want to, thank our viewers for, sparing their valuable time here. I know it's a testing time for every one of us, including us who are in healthcare profession. But please, trust your healthcare services. I know they are overworked, but they are there. None of the hospitals are closed in this pandemic. Every hospital is overflowing, but none of the doctors, none of the nurses have turned their back and they have gone home. They are all in the hospital. So, your mental health, your physical health is most important. Practice standard social distancing, sanitizing hands, putting masks all the time. All these things are very important. Save yourselves, save your family, save your society. Thank you very much.
On that very positive note, thank you, Doctor. Thank you, viewers. And tomorrow we were going to meet and talk about diet and nutrition to build immunity during COVID-19. And we have Ms. D.K. Daphne, Chief Dietitian of Apollo Hospitals, Chennai, who's going to join us and take us through this very interesting and important topic. Meanwhile, take care and be safe. And don't forget the SMS, which is the social distancing, the mask always on, and sanitizing. But before I leave you, I'm going to ask you, do you want to know how, or do you know that you have to sanitize? And when you wash with soap and water, it's not just washing quickly, but it has to be at least for 20 seconds. And there are certain steps to hand washing, which you might already know, but just to refresh your memory, you need to put soap and water. And first you need to wash the back of your palm, and then this, and then your thumbs, and then your hands like this, and then your wrists, and even you'll have to do this rotational back and forth movement so that your palm is nicely washed. But please, and also like this. These are all the steps of hand wash, and make sure that this is how you're washing your hands many times a day, as often as possible, and also use the sanitizer. Stay safe, stay well, stay strong. See you tomorrow. Thank you and namaste.
Namaste.